For joint palpation, there's certain parts of the joint that have more obvious joint pouches than others. So I'm going to show you where you're going to palpate for effusion in each of the joints. So for the coffin joint, you can, if a horse has inflammation in their coffin joint, which actually Tommy does, you will feel it, the dorsal pouch of the coffin joint be squishier or be more effusive, and you can actually maybe appreciate that, Randy, if you zoom in. You can actually see that his dorsal pouch is actually extending all the way up here and is quite actually effusive. For the pastern joint, you can't really appreciate effusion in the pastern joint at all. For the fetlock joint, you have the dorsal palmar pouch, or proximal palmar pouch. Sometimes you can feel a little bit of effusion in the dorsal pouch, but that's usually quite tight. So if you have effusion in the fetlock, you're generally going to see it in the palmar pouch here. If a tendon sheath is effusive, then you're going to appreciate effusion in the palmar aspect of the limb and occasionally down into the pastern area where that sheath extends. For the carpus, you need to pick the limb up and you're actually going to feel on either side of your extensor carpi radialis tendon, and to feel if there's effusion. It should feel like a divot on either side of that tendon in a normal horse, which Tommy is normal. Effusion of the elbow joint and shoulder joint you can't appreciate digitally. For the rear limb, same structures for everything below the hock. You can feel for tibiotarsal joint effusion in the dorsal medial pouch, which would be right in this area, and Tommy does not have effusion there. So right in this area. You obviously can't feel effusion in the distal hock joints because they're so close together. When you're feeling for stifle effusion, you're going to feel for your patellar ligaments. So right here, my fingers are on either side of the patellar ligaments right here. So they're actually a little bit lower than kind of the round part of the stifle. The ligaments are below that. And so you can feel, this is the middle patellar ligament, you can feel the lateral and the medial over here. And you just want to feel for those areas if there's any effusion and increased pouch space for that joint. If you're wondering about comparing the stifle joint, some people will actually come behind the horse and feel both stifle joints at the same time. You have to be obviously very careful when you do that because the horse can kick you.